Awesome. So my name is Jenna Deaver, and thank you so much for that introduction. I really appreciate it. I am going to talk about the South Carolina WIC program, and I'm super, super excited about it. WIC has a special place in my heart. I have almost been with them for 15 years. February is my 15th anniversary. So I'm going to go ahead and get started. I am going to turn off my camera, but at the end, I'll turn it back on so we can have a discussion. Okay. So just to start off, disclosures, I have no financial relationships with the manufacturers that I'm going to talk about or any commercial products and/or products or providers of commercial services discussed in this presentation. I will be going over some of the pumps that South Carolina provides, so I just want to put that out there. And then our ultimate goal with South Carolina WIC is to improve the health outcomes of South Carolina families by working together with our partners with the same goal in mind. So we really want to help our WIC participants be healthier South Carolinians, right? So we try to partner with other providers and organizations, and I'm going to talk about some of our partnerships later on in the presentation. So my objectives, so we're going to define the purpose and the mission of the WIC program, outline the WIC program benefits and the services South Carolina WIC provides, and discuss South Carolina goals and WIC health outcomes. So what is WIC? The WIC is the Special Supplemental Nutrition Program for Women, Infants, and Children, popularly known as WIC. WIC is a nutrition program for pregnant women, new moms, and families with children younger than 5. Our goal is to keep moms and children under the age 5 healthy and improve long-term health outcomes and food security for families. It is federally funded by the USDA, United States Department of Agriculture, and WIC provides one-on-one tailored nutrition counseling, healthy food, breastfeeding support, referrals to health and community services. And I'll discuss a lot of that in detail later on. So what exactly is WIC's mission? It's to safeguard the health of low-income women, infants, and children up to age 5 who are at nutrition risk by providing nutritious foods to supplemental diets, information on healthy eating, and referrals to healthcare. That is our mission. That's what we do day in and day out. And I think we do a pretty good job, but I probably need some of your help to help us do a better job. So we'll talk about those partnerships, and hopefully we can build some relationships here today. But I want you to watch a short video right now that gives you an overview of the WIC program from the National WIC Association. This video was done, I think, in 2014, so it's just a tiny bit dated, but I still think it has some great information in it. So that gives you a little bit of an overview. I think it's really neat. I love the little chime in the background too. So let's keep going. Oh, there we go. So there's a common misconception that WIC is only for women. And that is really not true. So WIC is for all kinds of families: married, single, moms, dads, grandparents, foster parents, working or not working, and military families. Anyone who is a caregiver of a child may apply for WIC for their children. In fact, we serve over half of all babies born in the WIC in the US. So WIC is for all kinds of families. So what do you do when you go to your first WIC visit? We get a lot of these questions. What happens? What do we do? How does it go? The steps, 1, 2, 3. So when scheduling the appointment, we'll inform our families of the items they need to bring, such as proof of ID for the mom and or her children, seeking benefits, household income and address, and we'll ask that the kids are present so we can check growth and iron levels. So we'll get to that in just a minute because I know COVID just kind of went crazy. We'll complete a health and nutrition screening and talk to the family about concerns or questions. After discussing nutritional needs, the participant will set a goal to meet by the next WIC appointment. As needed, we'll connect families to other health and social services and resources. And lastly, we'll teach them how to shop and use foods available in the program. They'll walk away with an eWIC card to use at the store right away. Then, depending on the family's needs, we'll see them again in 1 to 3 months. So COVID came in and changed all of our lives, right? So it changed for us too at WIC. So we are still virtual, and we're even working on expanding our virtual technology right now. So right now we ask participants about their heights and weights, and we encourage them to utilize their MyChart or documentation received at their last provider appointment, or their child well check. So I think virtual is probably staying around. However, some states have already opened and some of our participants miss coming in. So South Carolina is working on a way to be able to help all of our participants and to be able to meet all of their needs. So we kind of touched base on who receives WIC services, but I'm going to go into a little bit more. So who exactly is a beneficiary of WIC? Well, it's in our name: women, infants, and children. We serve pregnant women up to 6 weeks postpartum based on the estimated delivery date, breastfeeding women for 1 year after birth, postpartum women for 6 months after birth, including women who experienced a miscarriage or a fetal death, and babies and children up to their 5th birthday. They have to have an annual recertification, however. We complete exit counseling when someone graduates from WIC. Also, so participating women will be given one last counseling session along with a written exit brochure to reinforce the important health messages she has been receiving through the WIC program. We also complete this graduation for our children at age 4. The WIC program was established not only to provide food assistance, but to also empower program participants to make wise food choices, even after they are no longer on the program. We want that to continue throughout their life. So let's go over the eligibility overview. That can be a tongue twister. An overview of eligibility. In order to be eligible for WIC benefits, applicants must meet criteria in 3 areas: categorical, which is discussed earlier, be of limited income, and live in South Carolina. The length of the South Carolina residency is not a requirement, and WIC does not ask or keep information about visa status or citizenship. Participation in WIC will not impact a participant's ability to receive other services or attain citizenship. All WIC information is kept confidential unless permission is given to share with healthcare providers or health or community referrals. The only documentation we ask to view and verify for eligibility purposes is proof of ID, proof of income, or proof of current participation in one of 3 other government assistance programs. So I'll talk about that in just a minute. If someone absolutely has no income or is homeless, we have a procedure for that as well to ensure that they can receive benefits. Applicants must be seen by a health professional, such as a physician, nurse, or nutritionist, who must determine whether the individual is at nutrition risk. In many cases, this is done in the WIC clinic at no cost to the applicant. However, this information can be obtained from another health professional, such as the applicant's physician, if the child is unable to come into the clinic. Nutrition risk means that the individual has a medical-based or dietary-based condition. Example of medical-based conditions include anemia, low blood levels, underweight, or history of poor pregnancy outcome. A dietary-based condition includes, for example, a poor diet too. So we talked about those 3 government assistance. So it's designed to help families with limited income. Limited income may be determined by one of 2 ways. So families who receive Medicaid, also known as Healthy Connections, SNAP, also known as food stamps, and the temporary assistance for needy families are automatically income eligible. Current participation in these programs serves as evidence of financial eligibility for participation in WIC, since income screening has already been completed by these other programs. And it allows WIC to streamline services. Because this streamlines services and simplifies income eligibility, WIC always asks if families participate in these programs first before doing any other financial screenings. So the other way a family can be eligible if they do not participate in Medicaid, SNAP, or TAMP is that their household income must fall below 185% of the U.S. Poverty Income Guidelines to be considered for the program. Notice that the income guidelines table on the screen considers the number in the household and the entire household's gross income, that is before taxes or deductions are withheld. As an example, the weekly income for a household of 4 cannot exceed $988 or $51,338 a year or $4,279 per month. When determining the family size for a pregnant woman, we can increase the family size to account for the baby that she is carrying. Therefore, pregnant women could count as 2 members in the household. If she is carrying twins, we can increase the family size by 3, triplets by 4, etc. So we do ask for a confirmation of pregnancy, and this can be completed in several ways. We can do a clinical assessment indicating pre-assumption of pregnancy, an obvious advanced state of pregnancy, statement of the estimated date of delivery from a nurse or physician, or we can look at a copy of the ultrasound. It can be used, but we do ask that the participant's name or weeks of gestation and the medical authority who conducted that ultrasound documented on the ultrasound picture. So South Carolina. So how many participants have we served in the South Carolina WIC program? So this is data from November 2022, and we gathered this from the federal participation report that we send in to USDA. So a total of 88,763 were seen. Children is 47,036, infants 22,002, and women 19,725. And we're going to talk a little bit later and break that down a little bit more. We're still missing people in South Carolina. We have plenty more that we can help, and that's where I'm going to need your help. Nutrition education. So WIC regulations require that at least 2 nutrition education contacts are made available per certification period. And that nutrition education is designed to achieve the 2 broad nutrition education goals. WIC is more than just free food. Our caring staff may include registered dietitians, lactation counselors and consultants, paraprofessionals, peers, and sometimes registered nurses, all ready to listen, share information, and provide guidance to improve participants' health and nutrition. Families can receive nutrition education and food benefits remotely without them having to come into the WIC office for certain short follow-up visits when staff are not screening for eligibility or checking growth. This can be done by phone or online. And of course, families can still come in to be seen. Participants have access to a recipe library that provides ongoing ideas, education, and support associated with preparing and cooking an extensive array of WIC-approved foods through our online nutrition education platform, WIChealth.org. Sure, our participants can go to the web, try, and find a recipe that might work for the family. But is it nutritious? Does it capitalize on WIC-approved foods already in the pantry? Health eKitchen brings a collection of recipes and videos that address all of those WIC food benefits. So let's take a look at WIChealth.org. Okay. Oh. So next I want to discuss our healthcare referrals. So WIC refers. We look at immunization services, prenatal care, well child health care, social services, substance abuse, counseling and treatment, food assistance resources, dental care, smoking cessation, and so much more. Our WIC system also allows us to input local community and healthcare providers so we can print or email a list of locations and contact information for our participants, which makes it super nice for our participants that they can have something printed or emailed to them in order to have contact to those resources. So I'm going to stop right there for just a second before I start on breastfeeding promotion and support. And I just want you to put, have you learned something different about WIC and what we offer? Or is this all you've already known all of this? Will you put that in the chat for me? What did you learn new? Someone didn't know about WIChealth.org. Anybody else? Income requirements. WIChealth.org. Didn't know they needed to show proof of pregnancy. Nutrition website is new. Awesome. So we are trying to come up in the times, I guess you can say, and we're trying to add new things. And I'll talk about some of that innovative ideas that we're trying to streamline. But I really think that WIC is trying to help our South Carolina families. We really are. And if you know a South Carolina family that's having trouble in WIC, I know we had some issues, I think during COVID, with getting an appointment and moms and babies straight out of the hospital getting an appointment. So we changed some of our procedures where they can get an appointment across the state. They do not have to get an appointment in their region. So that kind of helped break up those appointment times, so they're able to get an appointment, a couple days after they get out of the hospital versus 2 and 3 weeks down the road. So if you know anything, or if you want to suggest anything, you can put that in the chat too, and I'll take it back to my leadership. So now let's talk about breastfeeding promotion and support.
Hey, Jenna, can I
Yes.
ask a quick question? It's Sarah.
Sure.
So you talked about registration during pregnancy, but what if people are not registered before they have their baby? Obviously, they need to provide those three. They can provide proof of Medicaid, I always mess that up, Medicaid, and or the other two documents. But what else do they need for their baby in particular? Like, what documents are you looking for after the baby's born?
So we can use the crib card or any of their information, like the information from the hospital, to get that baby on WIC. And a lot of times they'll go ahead and have their information, not necessarily, well, sometimes they do have their information for Medicaid already for their baby. So, but yeah, we try to make sure that we ask all the questions to try to get that baby on. So I mean, like the crib card, there's the Medicaid, there's paperwork and documentation from the hospital. So, I mean, I think a new mom should all have that.
Okay.
Does that
Right.
answer?
Knowing the crib card is very useful, because that's something that they have right there with them.
Exactly.
And then how long is the turnover time for them to get registered in hospitals? Like, if they register from the hospital the day after the baby's born, what should they expect for their appointment time? Like, what's the wait time? And that, you said that first appointment can be virtual, correct? It is virtual.
Yes, it can be virtual. So they have been out for a couple of weeks, and that's the reason we changed our policy and procedures, so that we could try to get them in a couple of days. So just let mom know that the phone call that she may receive virtually may come from Dillon, South Carolina, when she's actually in Spartanburg. So we're letting them know when they make that appointment to be looking for a phone number that may not come from your area.
Okay. Right. I feel like appointments, I think Chance said, I have patients who had to wait a few weeks for an appointment. Are they turning over a little bit quicker now, so that people are getting appointments a little bit quicker?
Yes. And so if you do have an issue, we do have a 1-800 number that you can call, and we'll actually get you in touch with a WIC coordinator throughout the regions that can kind of help with those appointments, and trying to get you in.
Perfect.
Yep.
Thanks.
Great. Awesome questions. Okay, so breastfeeding promotion and support. So breastfeeding and human milk are normative standards for infant feeding and nutrition for the WIC program. Breastfeeding promotion and support is a core function, and regulations intend that all breastfeeding women be supported to exclusively breastfeed their infants and to choose the fully breastfeeding food package without infant formula. WIC, state, and local agencies are required by the WIC program regulations to create policies and procedures to ensure breastfeeding support and assistance is provided throughout the prenatal and postpartum period, particularly when a mother is most likely to need assistance. So what does that support look like? So whether a mom is sure she'll breastfeed or still deciding, we're here to empower her and to offer her support and team evidence-based information and making an informed feeding choice for her infant and for her family. WIC promotes breastfeeding as the optimal feeding choice unless it's inadvisable for medical reasons, so families get the health, nutrition, and emotional benefits that research shows breastfeeding provides. An assessment is completed to identify a pregnant participant's knowledge, attitudes, and concerns related to breastfeeding and any factors that may affect her success with breastfeeding. And that's in the prenatal period. All staff have basic training in breastfeeding, while some offices have staff with advanced training. All are ready to help and listen to mom's desires and concerns. In addition, WIC offices have peer counselors that are available by phone or text and can help with referring to the lactation expert on staff or in the community if needed. Some offices may offer baby feeding classes and or support groups. So peer counselors, we always get questions about our peer counselor program. So peer counselors are mothers in the community with personal breastfeeding experience and training who give information and support new moms. WIC peer counselors serve as peer role models and provide basic breastfeeding education in clinics, homes, hospitals, and during normal business hours and beyond to WIC program mothers who are pregnant and breastfeeding. Research shows that peer counselors have a significant positive impact on breastfeeding initiation, duration, and exclusivity rates in the WIC population. So what a peer counselor does, they may talk about tips for how to breastfeed comfortably, even in public, ways to stay close to your baby through breastfeeding after you return to work or school, which is a biggie. Ideas for getting support from your family and friends, ways to get a good start with breastfeeding, tips for making plenty of breast milk for your baby, and help with breastfeeding concerns. And a typical day as a WIC peer counselor, they may be in the WIC clinic to talk to moms face-to-face. And they also, when we are in the WIC clinic, our nutritionists try to go ahead and start building that rapport by taking that mom to that peer counselor and introducing her face-to-face. They may teach breastfeeding classes with other WIC staff or lead mom support groups. They could be in the home. So some WIC peer counselors talk to new moms by phone. Oh, sorry, that should say phone, not home. They also communicate with WIC moms over email or text. This enables them to answer those questions and concerns from moms when the WIC clinic is not open. The hospital, we have MOAs with our hospital. So they visit new moms and help them get a good start with breastfeeding. And then other settings is we do make some home visits or lead mom group meetings outside of the WIC clinic. We do encourage moms to come into the clinic because if she does need to talk to a CLC or an IBCLC, or if she needs to get any supplies, it's a lot easier for her to come in and get those supplies versus us going to the home. So peer counselor contacts for South Carolina, we actually start contacting prenatally in the second trimester. So at 16 weeks, our peer counselors will reach out to that mom and introduce herself. And then she'll kind of touch base with mom, giving her tips and guidance from 20 weeks, 24 weeks, 27 to 40. At around that 40 weeks, 39 to 40, when we find out that mom has delivered, peer counselors must routinely contact a mom every 2 to 3 days in the first week and then after delivery. And if she has any issues, she has to contact her within 24 hours and then refer if she's unable to help her. So we have other designated experts in WIC. We do have CLCs and they have level 2 referrals. And then we have IBCLCs, which cover our level 3 referrals. And we also, our IBCLCs can refer out. So if we need to refer back to the physician, we can do that as well. So breast pump and loan program and breastfeeding aids. So breastfeeding is more than just providing food. Babies enjoy the comfort of being close to that mom. That's why whenever possible, we encourage babies to be fed directly from their mom's breast. And this also helps establish a good milk supply. Sometimes it's not possible to feed a baby directly at the breast for a number of reasons, right? So moms returning to work or school, medical reasons, or breastfeeding challenges, but we can still help moms provide their valuable milk to their baby. And a breast pump, with a breast pump, and we also offer the breast pump loan program. So WIC loans or gives away free breast pumps and supplies depending on the situation. We complete an assessment and help moms determine what is best for her breastfeeding needs. Some of the items we offer are loaned hospital-grade electric breast pumps, so our Medela Symphonies, and we have others. And then the single users are like the personal electric breast pumps. We have manual, handheld operated breast pumps, like the Harmony and the Haka. And then breast pump collection kits and aids, and education on hand expression. So every mom that leaves WIC should understand what hand expression is. We have a handout that goes through it step by step, and our nutritionists go over that as well in the certification to make sure that mom understands that. Information on how to use those pumps, they go over that if they do give a breast pump, and give moms those troubleshooting and even those websites to those pump areas. And then advice for starting and maintaining a milk supply, and tips for returning to work or school. So let's talk about the criteria for South Carolina WIC. So we have different tiers, I guess you could say. We have the multi-user electric, which is our loans. Our hospital strength single user electric, which is something new, so I'm going to talk about that. We have single user electric and single user manual. So the multi-user electric is intended for a WIC certified breastfeeding woman who has a medical need or whose infant has a medical need that requires hospitalization. Some possible reasons include special needs infants that are unable to suck adequately and hospitalized, premature heart problems, suspected galactosemia, Down syndrome, cleft lip and palate, failure to thrive or slow weight gain, participant or infant hospitalization, or another health problem. The infant has severe feeding problems and is hospitalized, and the participant that is relactating or inducing lactation. But at any point, if the assessment shows that mom needs a multi-user electric, we will loan mom a multi-user electric. We introduced the hospital strength single user electric tier this year so that we could free up some of those loaner pumps so that our NICU moms could continue to get those multi-user electrics. Okay. So then I'm going to go ahead and skip to multi-user manual. So we actually still have the pedal pumps. So it's intended for that breastfeeding woman that's WIC certified. The participant doesn't have to have access to electricity when she needs a pump. And the participant prefers single or double pumping using her leg or foot muscles. It could come in handy whenever we have a hurricane, right? Single user electric hospital strength. So this pump is intended for WIC certified breastfeeding women who has a medical need other than hospitalization or relactating or inducing lactation. The participant has difficulty with milk production due to illness or hospitalization. Participant has multiple babies, twins, triplets, and needs to increase milk production. The participant has severe recurrent engorgement. Participant has breast surgery or previous breast surgery. Participant is having difficulty in establishing or maintaining an adequate milk supply due to maternal or infant illness. And the participant is exclusively pumping to provide breast milk. So the next one is the single user electric. And this pump is intended for WIC certified fully breastfeeding women exclusively for at least 4 to 6 months and will not receive any WIC formula from WIC. So the participant is working or going to school more than 20 hours per week, is away from her baby for 9 or more feedings per week, and she is unable to feed her baby while at work or at break time. The infant is exclusively breastfeeding when the breast pump is issued, and the infant is at a minimum of 2 weeks old, 4 weeks old being the preferred issuance time. And mother and baby are having no problems with breastfeeding. If they are having problems, an assessment needs to be completed to determine the best solution for mom and baby. And then last, the single user manual. So this pump is intended for a WIC certified breastfeeding woman, fully or partially breastfeeding. So this is like a temporary problem, such as engorgement, sore nipples, clogged ducts, or flat and inverted nipples. The participant needs assistance to stimulate the letdown reflex, or she would like to increase milk in her supply. Brief separations from the infant for like social events or meetings, time away from the infant to seek employment, working or going to school part-time basis, so less than that 20 hours per week, and other short-time separations where pumping would not occur more than 8 times per week. The participant does not have access to electricity when she needs to pump is another reason we give manuals. Or the participant would like to catch and collect leaking milk. So that's like for the HACA. Okay, so next. So new to WIC. Everybody's kind of interested in what South Carolina did with that hospital strength kind of tier. And that language may change. We may name it something else, but we were trying to get these pumps on our inventory. So we are now offering the Unimom Opera, the Arto Calypso, the Rumble Tough Breeze, and the Hygeia Enjoy. These are not loaner pumps. These are issued to the moms based on that criteria. So this is that language that I just read. And if anyone wants the issuance or the criteria, I'll be more than happy to see if we can get that to you in an email. I know a lot of people are interested, especially some of our hospital staff. So I can get that to you. You can just reach out to me as well. I can put my email in the chat. So we also introduced some more single user pumps in October. So we are now going to have the Zami Z2, the Arto Alyssa, the Rumble Tough Easy Express, and the Hygeia Pro. We also continue to have all of our Medela pumps. So the Symphony pump is still on. The Advanced Double, which is called the Pump and Style, is still a single user. And we still have the Harmony as well. And we have the Swing pump as well, offered by Medela. So breastfeeding rates. Well, actually, I'm going to stop right there. So let's talk about pumps, because I know some of you probably have questions. So let's talk for just a little bit. You can unmute or put your question in the message, and we'll kind of chat for just a minute.
Hey, Jenna.
Yes.
This is Rachel. How do you make the determination within those categories? Does the client themselves, are they the one choosing what, if you've chosen which category might be appropriate for the client, then in those pumps in the category, how is the decision made about which one of those pumps that they get for that category? Is it by what's available in your area, or is it by what the client is wanting?
Yes. So it is what is available. So we are actually working on getting these pumps. This is new. So this came out in October of 2022. But we actually have not placed any of the bigger orders for these pumps yet. So where we're trying to use what we had in COVID, trying to get it down to a number before we placed an order. So you'll start seeing these probably in early spring. And we're going to try to start small. So you may see some of these pumps coming out, and then it will start growing as the program extends, and especially since when we have people start coming back in. We were kind of expecting that in April, but the waiver has been extended until July for virtual and because of the COVID waiver. So hopefully by July, we'll actually have participants coming into WIC.
Okay.
Did that answer that?
Yes. And so do they directly pick them up from their WIC office? It's not something that they choose and then it's mailed to them.
Exactly. So yes, they do have to come pick it up.
Okay.
And I've looked into mailing. It's very cumbersome. So there's a lot to deal with that, but we have looked into the mailing program, but unfortunately South Carolina WIC does not do that right now.
Okay. Thank you.
You're welcome.
Do you see the other questions in the chat box?
Yes,
okay.
I do. So Bonnie, I will get that to you. And thank you. Every region does not have the same inventory. I agree with that as well. Lynn asked, will the will the mostly breastfeeding mom still be eligible for a single user pump for return to work or school? So it's based on the assessment, and we always leave it up to our WIC breastfeeding coordinator. So even if mom doesn't fit in one of these categories, our WIC breastfeeding coordinator can always make the decision on what pump mom gets. So Tisha asked, how does WIC decide what companies to contract with to provide pumps? So we don't really have a contract, Tisha, and we actually did a collective survey. We went through the pumps. There was a lot of different things that went into deciding what pumps we were going to offer. So this was a long process. I think we kind of started in maybe 2018, 2019, and we just implemented it in 2022. So let's see. Jennifer asked, what supplies are available? Different flange sizes, breast milk storage bags. So for the pumps that I just mentioned, the Ardo, the Rumble Tough, the Unimom, the Zami, all of those, we are just giving them what comes in the kits. So they do get some flange sizes, they do get the pumping, but we are telling them to go to their manufacturer and get the extra supplies, making sure that it is registered and all of that. We are not going to carry supplies for all of these extra pumps. For our Medela Symphony, we do carry, and this is for our NICU moms, we carry the collection kits, we carry different flange sizes, tubings, anything like that that mom may need for that Medela Symphony. I would love a copy of the criteria as well. I will get that to you. Criteria.
Okay.
Okay.
I'm the names down for who wants them.
Yes.
I had
I'll
a question.
send that out to you. And we may be able to post it. I'll get just approval from leadership just to make sure that I can post it actually on another site. But I can send it to you for sure. Okay. So breastfeeding rates. And this is another one that I want to talk about in the chat. So November 2020, we were at 21.2%. Now, this is our WIC breastfeeding rates for South Carolina, okay? November 2021, we went to 21.8%. And November 2022, we're at 27.9%, okay? So 2020 was when we had COVID. We didn't really increase a whole lot, which I really thought that we were going to have some increases, but we really didn't see that in WIC. And then from 2021 to 2022, we had a huge jump. So I do know that the formula shortage had a major impact on the breastfeeding rates. And it's being seen kind of nationwide. So other WIC agencies are seeing that as well in other states. But I would love, love, love your input on this. So are providers encouraging it more? Is it breastfeeding just the forefront because of the formula shortage? What happened from 2021 to 2022 to have this major increase?
Is that an initiation rate, Jenna, or what is that rate exactly?
This is more of the initiation rate. So this is this is actually based on, let me take that back. This is based on who is actually on WIC as a partial or fully breastfeeder. So they are actually using their benefits and are active in the WIC program. These numbers are. This is not necessarily initiation or duration.
So this is a percentage of your clients on WIC during November 2022.
Exactly. Yes.
Okay. Who are breastfeeding?
Yes.
And is that mothers or babies?
This is babies. We take our participation numbers come from our babies breastfeeding. So I won't put my input in on that, but it's our babies in breastfeeding. So it's not our moms, it's our babies.
Okay. And
so if that baby is in the NICU, they are not being counted on WIC. Even their mom's on WIC.
Right. So this doesn't include your NICU babies.
Exactly.
Yeah. Interesting.
So Nobody's putting it in the chat. I would really like your input though. So if you can think of anything of maybe where you are, if your provider changed their language or started encouraging it, or something changed in the hospitals for discharge, or what happened? Are moms just nervous, so they're breastfeeding more? I would love to know why. Okay, I'm going to keep going though.
I have one thing, Jenna, I will say.
Sure.
And I know we've talked in WIC about this, and some of it, yes, I see some people saying formula shortage and things like that, and I think that did help. I will say one thing that I have definitely noticed that has been an uptick for us. I think that we're at the point that the next generation of moms is coming through, and this, even from my personal standpoint with family members, I have nieces and things that are now 20, 21, they're having children, and they're reaching out to me, and they have no history of breastfeeding, and they're wanting to learn and know, and they have been successfully breastfeeding their children. My own godchild, who's 23, had a child. She is totally breastfeeding him. She calls me all the time. My niece has a 2-year-old. She's still breastfeeding. So I think we're also seeing a transition to that younger generation of moms who's way more forward thinking and has thought this through and is like challenged enough to go against the status quo of maybe what they saw their parents and grandparents do. And they're reaching out for help.
Ooh, I like that. So that's interesting. So can anybody else chime in on that? Are you seeing the younger generation breastfeeding?
So I would say that is definitely true about younger generation. The other thing I see is you see moms who've maybe had some years between different children. Like, so they might have like a 7-year-old or a 10-year-old or a 12-year-old, and they come back in and this is, it's been a while and they're like, I'm going to breastfeed this one. And it's like they didn't try, or they really, they had absolutely no support for the first one. So I think there's also perhaps a perception of more support out there for them, which is a really good thing. And I don't know if that's the case, but it seems like people are more aware and more willing and think that there's more support to help them. Maybe the uptick in social media, like, hey, other people are doing this. Maybe I can do it this time.
Yeah, I was thinking social media may have played into it as well, because there's so many TikTok videos now with breastfeeding. So that's really interesting. So let's keep going. So next we're going to talk about the food prescription. So this is what we call their food package. So WIC helps families buy many of the healthy foods already on their grocery list. WIC gives families a monthly food package to buy foods that help with the nutrients that they need. The foods in their package will change as their needs change and their child grows. The foods are specifically chosen with the American guideline, or the guidelines for Americans, and are low in fat and high in fiber. Families will still need to buy food on their own, but WIC helps out as much as possible. Some of the foods available include milk, which is available in soy and lactose as well, cheese, eggs, cereal, juice, whole grains, fruits, fresh and frozen vegetables, fish, dried canned beans, and peanut butter. And the foods in the individual monthly packages vary. For example, if the mother is exclusively breastfed, then that mom will receive more quantities of food because she has a higher caloric intake. So each eligible family member receives their own food package, which is located on one EWIC card for the entire family. Similar to a debit card, much like the SNAP program. Just like your debit card, EWIC uses a PIN number, so benefits are saved even if the card is lost or stolen. A family can purchase WIC and non-WIC items in one transaction and pay the remaining balance using their SNAP or another form of payment. Benefits are added to the cards for up to 3 months at a time, but only the current month's benefits are accessible. Unlike SNAP, WIC food benefits do not roll over and need to be purchased during that designated month. So for tailoring and substitutions, we want the participant to have options and provide foods that can be used in their cultural diet. So as you can see, we offer different dairy, whole grains, and different types of milk in South Carolina WIC. So shopping for WIC food. So over the last several years, there have been a number of program improvements to make the program easier, more accessible, and to improve the shopping experience. One of those improvements is the shopping app. Families can also download this app on their smartphone, which allows them to scan a product barcode or UPC while they shop to see if the product is WIC eligible and if they have enough benefits to purchase. Kind of gives them like an X or a check. They can also view their current WIC benefit balance from their smartphone, allowing them to know with certainty what they can purchase. This takes some of that guesswork and frustration out of the WIC shopping experience. I know we've all been in line behind somebody that has WIC and they're running back and forth to the shelf trying to get the correct item. In addition, the WIC app can locate WIC authorized stores in South Carolina. For those participants who choose not to or cannot download the app, we continue to have the list of foods available and a shopping list available for families. So food benefits for South Carolina. As you can see, we purchase a lot of food in South Carolina. There's 620 grocery stores in South Carolina that accept WIC. And another less obvious benefit is the benefit for local businesses that they receive. Last year, on average, local area grocery stores gained over $5.3 million in revenue purchases made by WIC participants monthly. In order to deliver benefits to participants, WIC depends on the partnership with approved grocery stores to carry the foods that our participants need. Thus, grocery stores must apply for participation in the WIC program and must meet a minimum stocking requirement before the WIC allowable foods so that the foods are available in sufficient quantities when the participants need them. There are 620 grocery stores in South Carolina that accept WIC and include large retailers such as Walmart, Food Line, Target, Harris Teeter, Ingles, and even smaller local stores. Remember, the food dollars I shared earlier of $5.3 million spent on monthly food? This brings dollars to communities across the state. So let's talk about the Farmers Market Nutrition Program. A lot of people don't know about this. So the WIC Farmers Market Nutrition Program, FMNP, was established by Congress in 1992 to provide fresh, unprepared, locally grown fruits and vegetables to WIC participants and to expand awareness, use of, and sales at farmers markets across South Carolina. During the summer months, select public health departments participate in the WIC Farmers Market Nutrition Program. So all health departments do not participate. Women and children that have been certified to receive WIC are eligible to participate in the WIC FMP program. WIC participants will receive $5 checks up to $25 to purchase South Carolina grown, unprocessed, fresh fruits and vegetables and herbs at approved local farmers markets and farm stands throughout the state of South Carolina. Participants also learn how to choose, store, and prepare fresh produce by attending nutrition education classes for farmers market. Due to limited funding and supply of FMNP checks, not all eligible WIC participants will receive farmers market benefits. So next, you may have seen this van. Some of them are actually getting a glow up and they're actually being wrapped. I found that out today. So it may be very bright the next time you see it. So I'm really excited. They've even added, heaters and air conditions so that our participants will be just like they're in the clinic. But it's actually, this van goes to our participants. So despite the great benefits WIC offers, there are many barriers keeping potential participants from utilizing the program services. One of the biggest barriers known to influence WIC participation is transportation. Many clinics do not offer opportune hours, and even when they do, many participants have trouble getting to the clinics. To combat this barrier, each of our geographic regions has a WIC mobile unit. So this is PD region, Low Country region, Midlands region, and Upstate region. The goal of these units is to meet participants where they live, work, and play, and provide on-site certifications. I do know that the WICSO van goes to MUSC and helps those moms that were having difficulty getting appointments. So whenever they're discharged, they walk right outside, go to the van. If it's there, they are certified and leave with a breast pump. So we are super excited to partner with MUSC with that initiative. Next, so what's coming to South Carolina WIC? So TeleWIC is coming in 2023. So we're super excited about this. So for the TeleWIC pilot, it's going to start with high-risk participants, and RD and CLC IBCLCs will be completing these consults virtually. So it's going to be like a face-to-face. So just like you have a TeleWIC appointment with your doctor, WIC's going to be able to do that same thing on a platform. There's also an on-demand selection that participants can speak with a CLC or an IBCLC during specific hours. So it's going to be at a click of a button. If they are experiencing any issues, they can click and they'll be automatically directed to a CLC or IBCLC that's on call. And then pilot sites for 2023 are Low Country, Holly Hill, Mount Pleasant, and Northwoods. And then in the PD region, it's Clarendon, Florence, Lee, and Myrtle Beach. So we're going to pilot these for probably 6 months to a year in these pilot sites, just to make sure that we have the program up and running and make sure that we get all the kinks out. And then once we do that, it will go statewide. So we're super excited to be able to offer this innovative idea, and we are ready for it to get started. So the next thing that's coming is an online application. So the online application process will begin the process of applying for WIC. So participants will use a web-based platform on our DHEC website to complete the application and be able to upload documentation to verify eligibility purposes like their proof of ID, their proof of income, or proof of current participation in one of those 3 other government assistance programs. So this makes it so much easier for our participants to apply. They can apply at 12 o'clock midnight if they want to, or 2 o'clock in the morning, or in their PJs. It's fine. And then they'll be contacted, and we can still complete that certification virtual if they are eligible. So it's super nice to go ahead and get that started. A lot of WIC agencies across the U.S. are already starting to do this, and they have found that it works well for participants. So there is clear evidence that good nutrition during pregnancy and in the first few years of life has long-term positive impacts on health. WIC has been shown to yield better birth outcomes, increase breastfeeding rates, increase key nutrients in the diet, help ensure adequate growth and development. WIC services and benefits ensure that children get a strong, healthy start in life. Children who participate in WIC are more likely to receive regular health care, have higher immunization rates, and experience fewer childhood illnesses such as ear infections, stomach viruses, and colds. Through tailored education, WIC supports caregivers in making informed choices about feeding their family. WIC is efficient and leads to healthcare cost savings. A study by the USDA found that for every $1 spent on pregnant women in WIC produces $1.92 to $4.21 in Medicaid savings for newborns and their mothers. So another study we found is breastfeeding outcomes associated with the Special Supplemental Nutrition Program for Women's, Infants, and Children's, a systematic review. So for this background, the WIC promotes and supports breastfeeding for low-income women and their children. A prior review reported negative associations of WIC with breastfeeding outcomes. So the WIC food package changes in 2009 increased breastfeeding support. So if you'll look here, this is WIC participation is associated with no difference in breastfeeding initiation, and evidence is insufficient regarding duration or exclusivity. In 2009, the WIC package change is positively associated with breastfeeding exclusivity, and WIC breastfeeding support services are positively associated with initiation and duration. So you can tell that the change in 2009 actually had a positive effect, not a negative effect. And in 2009, what happened is they increased a lot of the foods, and the breastfeeding packages actually grew a lot bigger for the high caloric intake. Even moms that are breastfeeding with twins or triplets get more food based on how many infants they're breastfeeding. So now we kind of talked about some of those, how many people we actually see, but this is our coverage rates. So this is an estimation of the percentage of pregnant women, infants, and children who participate in the South Carolina program among those who are eligible in the general population. So we have 165,169 total eligible people in South Carolina that are eligible for WIC. And the average participation is only 73,496. So we're only actually covering about 44.5% of people in South Carolina. So we could be touching a lot more people, and we don't really understand, other than we've had some participants say that the nutrition education was cumbersome coming in to WIC. A lot of people don't like the foods on WIC because we tailor that for health. But do you know anything other? I would love to know what you think about this in the chat. What are some other reasons you think that we're not reaching these people? Do people just not know about WIC? The WIC program? I know a lot of military families qualify, and they don't understand that they qualify. So we actually do have some WIC offices on military bases, and we do some outreach to our military bases. Also, some of our teachers actually qualify and don't understand that they do. Anything
Hey,
else?
Jenna.
Yeah.
So I work with pregnant people that are the age of 25 and younger. And what I have seen so far, just from like my clientele base, it is like one of the subjects that we do touch on as being their doula. That is something that we touch on. So we just try to make sure that we're providing resources like, of course, WIC, SNAP, TANF, just different resources that we think would be very beneficial for them and the baby. And a lot of my moms who I have told about WIC, is what I've seen so far is not that they don't know about it. It's just that they either don't know that it's virtual, don't know or don't have a ride to get there, or they feel like, well, once I get signed up, I have to wait all of this time before I get my benefits. So that's what we've been seeing just with Birth Matters. A lot of our moms are just saying that they either get an appointment and they just have to wait a little bit longer, or they either just don't have the transportation or don't know that it's virtual.
Got you. Thank you for that input.
Yes, ma'am. Absolutely.
Anybody else? And I don't know how many people know that we've actually gone to EBT. So a lot of people still see WIC as those checks and standing in line and all of that. They don't realize that it's just a debit card, and it's actually pretty easy now. And as far as the innovative ideas, as far as the app, and you can automatically see everything. You can scan stuff and make sure that it's WIC eligible before putting it in your grocery cart. So whenever they get up to the line, it's not embarrassing, because we did find out that participants said it was embarrassing that they didn't have their foods correct, or they had the wrong size, and then everybody looked at them like, oh, you're on WIC. And they're trying to move to another line because it's taken up some time. Is there anything else? So we've tried to improve that process.
There's a couple of comments in the chat box. It said, Jennifer Kaczynski said, I would say 90% of patients I asked don't know about the breastfeeding program. And then Naomi said, I often remind folks what WIC offers. They don't always realize it's more than one thing. And then it's either Rachel or Tanika. I've had a couple of moms lately tell me they tried to enroll in pregnancy and were told WIC has changed and doesn't cover pregnancy anymore, although they qualified economics wise. That would probably be Rachel.
No.
Yeah,
So
that's me. And
yeah, it wouldn't be Tanika, probably Rachel.
and they're trying to, they go through the certification phone number to make an appointment. And so they don't even get past to make an appointment. Whoever is on that line is telling them that if they haven't had their baby yet and can't come in with their baby, then, they're calling way too early.
So as a pregnant mom, they're saying that they don't qualify.
Yep.
Oh, wow.
So they won't
they're saying that they have to be be postpartum, essentially.
Yeah,
Oh,
that they have to be
no.
able to come in with their baby to do their first certification appointment.
That's terrible. Yes, we can work on that. I will make sure that leadership knows that so that we can talk to our appointment line. And that's like the appointment line number that they're talking to?
Yes.
Okay. Yes, we can work on that.
Thank you.
I think there's comments here about waiting the appointment for, to get their appointment for WIC is taking a long time. And I have definitely heard that as well. You ask people when their appointment is, and they're like, oh, well, and they give you a date like 2 or 3 weeks in the future. And you're thinking, oh, that's not soon enough, So I think there is that wait time still that turns people off.
Yeah,
Right.
and the wait time as well. I had a few moms say, well, I tried to call today before I left, and, the staff are asking me to go in to see a mom, and I go in and she hasn't been breastfeeding, and she had tried to call and make an appointment for WIC to certify as a formula feeding mom, and her appointment wasn't going to be for 3 to 4 weeks. And so she decided all of a sudden before she left, well, maybe I should be breastfeeding. She didn't want to breastfeed.
Delaying those appointments. No, I'm just kidding.
It wasn't something that she was really interested in doing and didn't really want to, but she wanted to feed her baby, and so of course I treat them like any other mom, and I have no idea. I leave messages for those moms after they go home, but they don't always call me back. So I don't know what kind of result long-term, if they nurse much longer or not, but.
That's
It's
so
different.
interesting.
And Tisha says I also spoke with a Prisma doc that most moms in their clinic don't enroll until postpartum.
Oh, wow.
So, that's another, like one of those things where why do we need to be on those BOI calls, right? It's
Exactly.
because, where if people are seeing their OBs, that OBs need to know what the deal is with WIC, and so that they can have that to pass on to their patients. So
Yes, I definitely see a lot of moms in the hospital, and I'll ask them, are you a WIC client? And they'll be like, well, no, I'll do that now, but I didn't in the pregnancy. Either they didn't know that they didn't know any benefit of why to do so.
Right.
Or no one has even told them that it was a possibility in pregnancy.
Right.
They kind of just thought of it as, oh, that's how I get formula. I breastfeed and give some formula too. Or if this doesn't work out, my formula is going to be an option, and I need to do that with WIC.
mm-hmm.
That's interesting. So Jennifer, I also see that you put in here that you would say 90% of the patients do not know about the breastfeeding program. So they know about the WIC program, they just don't understand about the peer counselors, CLCs, or IBCLCs that are in WIC. Is that correct?
Yes, I agree with that too. Most of my clients still think it's all about needing formula. And if they don't succeed at breastfeeding, then definitely they'll need to do WIC.
Oh, wow. Okay. Well, I've got some work to do then, don't I? Melissa, organic. So yes, we are working on that. You may actually see a change this year with some organic foods. There was a lot of talk at our last meeting for the food package. And I don't know if y'all were on the USDA call. There's a lot of changes that may be coming down in the next year or so with WIC. So I'm interested to see what happens too. So maybe even some age changes, possibility of mom possibly being on WIC for longer if she's breastfeeding. So more than that year mark. So it's really, really interesting what USDA is looking at as well. Are more moms participating in WIC earlier and learning more about breastfeeding? We are starting our contacts earlier, Tisha. So we're hoping that we're trying to get that rapport building, in that second trimester. We saw and talked to our peer counselors that a lot of times when they started calling in the third trimester, the moms almost at the point of delivering. So we ended up pushing it up a little bit more. So that way our peer counselors can have those conversations and build that rapport, given those tips and guidance. So you saw the formula shortage did have a significant impact. Janice Jenkins said from a patient perspective, it was encouraged more at the hospital at the time of birth last year when I had my first child. So you really didn't get that encouragement as a prenatal, correct, Janice? I can't see. She might be. I'm hearing.
Sorry, that's correct.
Got you. Okay. I'm just going back. I didn't realize I had this many comments.
I was looking for the unmute button.
You are good. So we've seen the same uptick in our initiation and the formula shortages where our clients were telling us and the driver for them to consider breastfeeding when they wouldn't have before. Awesome. Okay, so thank you so much for those comments. I apologize that I didn't see them when you did that, but I'm looking at my messages now. So any of you on my team, if you'll just kind of keep watching and make sure that I'm catching those. So next, this just kind of shows the breakdown of what we just talked about as far as that not reaching those participants. So this is what we're seeing. We're only covering, 44.5% of the combined, but we're only getting 20% of our pregnant women. And based on what you just said, we obviously have a lot of work to do there. And it seems like as, the infants are being born, that's when they're getting the information to come to WIC, because we're seeing 86% of our infants. And then it seems to die off for children, and it's 41.7. So I think a lot of moms feel like they do that infant, the child turns 1 and then WIC goes away, but that's not true. It goes to their 5th birthday. So I don't know if moms are not realizing that, because we do have a lot of moms that, this is their second child. They come into WIC and their other child is like 2 or 3, and they're like, oh, I didn't know that my 2-year-old could be on WIC or my 3-year-old could be on WIC. So we really do have a lot of work there too, to kind of let moms know that, no, we're here for you till age 5 as long as you're eligible. So we have lots of work to do in the prenatal world. So it looks like we're going to be doing a lot of outreach to our OBs and letting them know maybe we can send this presentation to them. All right.
Jenna,
so let's keep going.
I'm sorry.
Go ahead.
Are you saying that this 44.5%, is that 44.5% of pregnancies in the state, or what exactly is that?
This is WIC eligible. So we're only covering 44.5% of WIC eligible participants.
That
So
they would
what
be
we just
eligible,
saw
they just
here-
haven't applied.
Yes. So this 44.5, so these are the eligible participants. And then this is actually what we're seeing. So we're only covering 44.5. So this is just the breakdown of our categories.
Okay, thank you.
You're welcome. Okay. So we need you. So we need you to include WIC. American Academy of Pediatrics recommends physicians refer eligible patients to WIC. We can connect with your patients with resources outside of WIC, including healthcare professionals like dentists, substance abuse counselors, domestic abuse counseling, smoking cessation programs, and other social services. Our caring staff may include registered dietitians, lactation consultants, paraprofessionals, peers, and sometimes registered nurses, all ready to listen and share information and provide guidance to improve participants' health and nutrition. We follow up with your patients and their children at least every 3 months, depending on the appointment time. This may be in person, over the phone, or through online education, nutrition education. So connecting families to WIC. So when you refer potential eligible families, you're helping to ensure that they have wholesome food, nutrition education, and community support to keep themselves and their children healthy. And connecting families to WIC is very easy. And there are several ways families that you can help them. So the DHEC clinic appointments, using the online web chat, families can call out. They can use the web chat on the DHEC online, so scdhec.gov. They can call the appointment line at 1-855-4 South Carolina DHEC, or they can go to a WIC office and they can sign them up there. Or you can also call an office as well to apply. A member of our WIC staff will ask a few simple questions to determine potential eligibility and provide a date and time for an appointment at a WIC office that's convenient for the family. And right now we're virtual, so it's pretty convenient. And like I said, they just have to remember that telephone call, I know we all get, sometimes we get scammer calls, but they have to remember that call may come from all over the state. So even though you may be in upstate, a nutritionist in low country may be completing your certification. Or a family can choose to go into any WIC clinic in the state. So whenever we go back in person, they're able to go to any WIC office they want to. So they don't necessarily have to go to the WIC office in their county. If they like the next county over, or if a mom works in the next county over and it's easier for her to complete that certification, where the daycare is, then that's fine. She can go to that clinic. So one more little video, just to kind of see that everyone has a role in making breastfeeding the easiest, most convenient way for a mom to feed her baby. From hospital systems and retail stores to child care centers and faith-based groups, we can all work together to make breastfeeding the norm. Create comfortable spaces for moms to breastfeed their babies in public, set up lactation rooms for moms to pump at work, and so much more. We invite you to partner with WIC to help ensure moms have the support they need to breastfeed successfully. Here are some ideas, so let's watch this short little video.
Since 1972, WIC has provided breastfeeding promotion, support, and education to eligible women, infants, and children across the United States, U.S. territories, and Indian tribal organizations. Partnerships between community groups and WIC help moms reach their breastfeeding goals. Partners find many great reasons to partner with WIC.
The opportunity to have an impact on the beginning of a life, the beginning of a relationship between a mother and their newborn baby is one of the most powerful experiences you get to be a part of.
We were seeing many of the same families, and we were both interested in maternal and infant care. The partnership between WIC and healthy families seems to be a natural relationship.
Everything we do successfully involves a partnership.
WIC and their partners are making it a priority to encourage breastfeeding mothers every step of the way.
We, as a coalition, aren't here to make people breastfeed. We're here to provide the support or connect moms with the support that they need to reach their goal.
Child care providers, businesses, faith-based, and other community groups can engage with WIC to be breastfeeding friendly and supportive.
I think the highlight for me working with WIC on this program has been spreading the knowledge. Knowledge is power, and it's very positive and it's uplifting.
Collaboration is key to achieving healthy, successful breastfeeding relationships.
We partnered with healthy families when they saw a need in the community for extra breastfeeding support and help.
We go out into the homes, we serve pregnant women and women that have had a child.
When a WIC nutritionist has a goal, the early Head Start worker can then repeat the same goals in the home, kind of a united front and working on the same goals.
So we've been able to weave a blanket that covers all moms in our community that can receive breastfeeding support, assistance, IBCLC care.
Community groups can provide new mothers with a safe place to share their experiences with each other.
LATCH stands for lactation, awareness, technique, counseling, and health. If they're having any questions, difficulties, if they want to share any successes, build up the bonds of the breastfeeding community so these women feel like they have a support system.
The mission is to provide services, educational and social services to our community. Part of the WIC program is to promote, educate, and support breastfeeding. That's why we have the Baby Cafe here at the center.
They find the confidence and resources they need to achieve their breastfeeding goals.
I've met other moms who are opening up. It's good to be around that type of environment, especially with the babies. It made me comfortable to breastfeed in public, which I never did before.
And equipping local businesses with awareness and support.
DC WIC program is expanding on our partnership and the Breastfeeding Friendly Workplace Awards by providing a breastfeeding friendly workplace toolkit to establish a breastfeeding policy, the best practices for lactation rooms, as well as describing the laws that are in place to support mothers that are breastfeeding.
Means mothers can continue to feel comfortable and confident breastfeeding their children no matter where they go.
It's not rocket science. We just create spaces that she feels comfortable doing it. Not in the bathroom, not hidden somewhere. A place where a woman feels comfortable breastfeeding her baby.
But the encouragement doesn't end once mothers have established a breastfeeding relationship. Child care providers can play an important role in ensuring mothers have the support and assurance they need.
The Breastfeeding Friendly Childcare Program started with the 10 Steps Toolkit. I was interested in, becoming breastfeeding friendly. They said, okay, let's set up a time. They sent me out all the information. This is, the requirements. This is what you're going to have to do. It was so simple. It was very easy. The staff was amazing. They were very helpful. We were able to create the program to go along with those 10 steps. So all of their infant and toddler room staff were trained on breastfeeding.
Everyone wants babies and families to be thriving and healthy.
My greatest satisfaction is just to see the mothers reaching their breastfeeding goal.
I think it's helped all the children. It's helped all the children in our community. It's helped moms and dads and grandmas and grandpas.
When we support each other, the whole community benefits.
We realized that moms needed support. And so it just was kind of a gift of love back to my community.
I come to work every day because I know that what I'm doing does matter. It does leave an impact on the families that I'm working with, and I care about what I do. Just get in touch with us. We're there to work with everybody.
And reach out. The WIC programs are more than willing to work and help with any community organizations. They usually just need that stepping stone.
Ready to connect with WIC? Find out how you and your organization can encourage, support, and educate breastfeeding mothers in your community. You can find out more information on the WIC Works research system online, wicworks.fms.usda.gov.
WIC is just a fabric, part of a quilt of our community.
So that just kind of gives you some ideas of ways that we can partner, maybe with your organization or maybe with your private practice. I mean, even we provide our WIC handouts free that you can put inside of your practice or let moms know all about WIC. So I think this is really important that we did do this and that people are learning because it sounds like we have some work to do. And this is actually from our South Carolina WIC participant. I just want you to take a moment. We're going to kind of just stay quiet and actually take in what she says. So that's pretty powerful. So my children don't starve and I don't have to steal to feed my children. That actually came from our South Carolina WIC participant from our participant survey last year. So this is very recent. It was from our 2022 survey. So next, this is just our USDA policy that we have to put up here just to let you know all about the WIC program and discrimination. And then here's my information. So if you need to contact me, you can contact me through deaverjh@dhec.sc.gov. And I know I've been looking at your chat. I think Sarah's got me a list of who would like to have that copy of the pump stuff. So we do have a survey, or not necessarily a survey. It's kind of like a short little test, post-test, in order for you to be able to get your CERPs today. So Sarah is going to put that in the chat. But while she's doing that, I'm sure some of you probably have some questions, and I would love to answer those now. I think we're going to do a little bit of networking after I answer the questions.
Hey,
Thank
Jenna,
you, Tisha.
I just had a quick question, just out of curiosity. When I worked at the health department, they were gracious enough to send us to the lactation counselors certification thing. So I was just wondering, like, so the peer counselors that are there now, do they also still get the opportunity to go to training?
So our peer counselors do not get the opportunity as much because they are supposed to be more of a peer support. We don't want them to have, I guess, I don't know how to explain that. I'm sorry. But we do have a next step. So for our peer counselors, we have peer counselors level 1, which is more of your basic breastfeeding knowledge. And then we have our senior peer counselors now. That is something new. And they are CLC certified. So they are able to go and get that education. And they're more of a mentor for our onboarding peer counselors that help in the communities as well. So yes, I guess you can say we do send our peer counselors to CLC training. We do send our nutritionists as well to CLC training. There is some guidelines as far as you have to be with us for so many years and different types of things. So if you are a nutritionist with WIC, you can ask and see if you're able to go to the CLC. We've had a couple of people that actually have done IBCLC, and that's our next step in the ladder. So hopefully, eventually, we may be able to kind of help our staff get to the IBCLC level.
Oh, wow. Okay.
Go ahead, Jennifer. Thank you.
Yes, I had a question about pump eligibility. And I was wondering, has there been any discussion about that, school work criteria? Reason I'm asking is that, most women with private insurance can get a pump at any point in time, and that is granted to them. And it just feels like a barrier to have, for a lot of our breastfeeding moms, to be kind of forced into the exclusive breastfeeding when a lot of them, for them, that's too overwhelming, and they'll just start switching over to formula when they don't have the option or access to a pump. So I just wondered if you could speak to that at all.
Yes, sure, Jennifer. And I don't know who put that in there. I think that's Tanika. We do help them navigate Medicaid plans as well. So that is actually in our state plan, which is kind of like our little guidance for all staff. So that we kind of talk them through that actually in the prenatal period, because they're able to get a pump easier and sometimes even faster before they even deliver through their Medicaid versus WIC. But we do not hold that against them if they get a pump from Medicaid. So if it's not meeting their needs, that's the reason that assessment is so important. So maybe the pump that they receive from Medicaid is not giving them the milk supply that they need in order to feed their baby. Then after that assessment, then we figure out what WIC pump works best. As far as that single user and the guidelines for moms, as far as that exclusivity, if a mom comes in and she is not eligible to get a pump in that area, the nutritionist can call the WIC coordinator, and she has the ability to make any decisions. So it may be that we come up with a plan as far as giving mom a manual pump or maybe a swing pump, possibly. Or it may be that she does need a, the single user pump for one of those ones that I just talked about, or maybe the pump and style from Medela. So, that assessment is so important. And what's written there is not necessarily in stone. We always have the conversation. Does that help, Jennifer?
Yes, thank you.
You're welcome. Yeah, we make sure that we explain to staff that if they have any questions, to reach out to their breastfeeding coordinators. And there's 2 breastfeeding coordinators per region.
Hey, Jenna,
Yes.
This is Sarah. I was thinking maybe you could turn the slide, stop sharing the slides, or maybe,
Sure.
And that way we can all see each other when we talk. I was going to also say, I think that's, in terms of pump availability, I find that people who are on Medicaid have not really explored whether they can get a pump or not. Like they just haven't really done that, even if they had planned to breastfeed before. And they also, they don't really know that they can get a pump. That's always news, that they can perhaps get a pump through WIC as well as through Medicaid. And then I would say, really that the barrier exists is because they can't get a pump before they have the baby. And, those problems, you have a SGA or less than 6 pound baby, 37 weeker, those are the moms that are going to need a pump. If you got, little one that's not doing the job, or mom's milk, about 40%, 20 to 40% of moms have their milk come in a little bit late. And then you've got problems if you don't have a pump from the get-go. So I feel like, that's just a huge barrier, that if moms had a pump beforehand, before they had their baby, maybe that would A, get people to sign up prenatally, right? And B, work to help those moms that actually do need a pump for a very short period of time to help things get off the ground because they were maybe not super healthy when they had their baby, and there's a lot of complications, and their babies aren't, were induced early because they had hypertension or something like that,
Yes. So that's the reason all of our CPAs, which that's our nutritionist title, they are going through that Medicaid navigation now prenatally to kind of help with that. Unfortunately, our policies and procedures in WIC will not allow us, unless it's medically necessary, to give a prenatal participant a pump. And I know that stinks. I wish it could change. We may get it changed in the future, but right now there's some really strict guidelines. So there is a way that a prenatal possibly could get a pump, but it would have to be an extreme measure. But as far as us trying to get moms to understand that if they are on Medicaid, they can get a breast pump and it's there for them in case they do have these issues. So that way they'll have a pump in hand. And then if it doesn't meet their needs, in those first couple of days, then we're getting them in and trying to do that breastfeeding assessment to get them the pump that works for them the best. So we've kind of worked and changed. Go ahead.
I want to add something to that. One thing that's been helpful, because I'm on the end of having to train our CPAs on how we help moms navigate Medicaid. I think that we just collectively, as the practitioners that are not just WIC, but everybody on board, we say that a mom that's on Medicaid can't get WIC. That misunderstanding is that Medicaid is who is providing her insurance. She's a part of Blue Cross Blue Shield. She's a part of First Choice. But because we've always said that narrative that she's on Medicaid, we shouldn't be involved in who's paying her insurance company. The insurance company is the important thing. So because that's kind of the narrative, that's why the moms aren't normally reaching out, because they don't understand that just because they are receiving their managed plan through Medicaid doesn't stop their insurance benefits. And so that's one thing that we're working on with training, is just changing that narrative that she participates in Medicaid, which gives her a managed plan. She's a member of Blue Cross Blue Shield, and we're going to help her navigate with Blue Cross Blue Shield, because they don't really understand the managed plan thing.
Exactly. And so each plan has different pumps. Some of them even have lactation care where you can talk to someone. But each plan has different pumps as well. So our nutritionists were kind of taught that this past October, and like Tanika said, they're being trained now to have that conversation. Any other questions? Thank you, Kristen, for that information. We're going to try to get that survey fixed. Sorry about that.
I'm working on it right now. It'll be 5 minutes.
All right. Anything else? Any questions about the new pumps that we just brought in October? You may, like I said, see those more in the spring, just because we are using up some of our COVID pumps and trying to get our inventory so that we can house those newer pumps in our inventories.
Hey, Jenna, you talked about flange sizes for the WIC stuff. Do you have anything but the 21s?
So I don't really know from region to region, to be honest with you. Tanika, can you talk for your region? Do you have any 21s?
I didn't hear the question. What was the question?
What flame sizes do you have? Do you just all have the Medela 21s for, and the 24s?
I order 21s up to 36s in the Midlands. It can vary like what is on stock at a particular site, but normally if it's not at one site, I can move it from another site pretty quickly.
Okay.
And some regions do have it's the pump and pals, right? And Tanika?
Yeah,
some of us do order those.
I don't order pump and pals in the Midlands, but some of us do still have some from, when we ordered before that can fit. But I do kind of stay with the Medela phalanges, since the normal time that I'm doing pump sizing the most is with our symphonies.
Exactly.
And I try to keep those smaller and larger sizes on tap.
Yes. And I do think the Medela, I know Bonnie had to hop off, but I think Medela is reevaluating their flange sizes. So they may actually be going smaller as well. Yeah. Any other questions?
Are you guys thinking about doing more trucks like to deliver pumps to hospitals and other places?
I would love to do that. Actually, during COVID, we looked at mailing pumps. I know some of the states, I want to say it was maybe Kentucky, possibly, or Virginia. They actually worked with some of their manufacturers where they actually mail the pump to the participant. So we looked into that. There's a lot of different, some red tape with FedEx and stuff like that. And then, some of our participants move. So making sure that the pump's signed for, and then if they're not there. So there's a lot of different barriers. And we knew moms really needed that pump then. So it's really easier for her to come, even curbside. I mean, we'll bring the pump out to her. She just needs to call us. So if she's unable to do that walking, we'll come out to the car and get her to sign the information that she needs in order to get her pump.
Perfect.
Okay. Anything else? So if a mother has WIC but wants to exclusively pump, can she get a pump? Yes. And actually, she's going to get one of those hospital strength pumps for exclusively pumping. And we understand that some moms have some reasons that they just want to exclusively pump and not put the baby to the breast. So that will be done during the assessment and making sure, that she's going back, she's not with the baby all the time. So we have to look into all of that. We're just not going to immediately give her a pump just because she's exclusively pumping, or not necessarily exclusive. Yeah, that's right. Exclusively pumping because she's not putting the baby to breast. I got too many things on my mind. But yes, so we're going to do that assessment. If she's exclusively pumping, not putting the baby to the breast at all, then she will get one of those pumps. There we go. I got it right now. What else?
Oh, when do you guys think you're going back in person?
So we were kind of thinking that we were going back in person in April of 2023, but the WIC waiver was extended until July. So right now they're kind of looking at some soft rollouts throughout the state. So it may be that some offices will be opening. I know we're already seeing some breastfeeding participants throughout the state. So if they have any issues, they're coming in for an assessment in clinic, so we can do the CLC and IBCLC assessments in person instead of on the phone or virtual.
Cool.
Okay. All right. So if there's not any other questions, I know Sarah's kind of working on that questionnaire, so she's got it up. I can see her typing. Let's just have some conversation. I know we talked about some local and regional ideas of possibly, we want to get that back started. We are starting to see some people in person, and even we might even be able to do some virtual groups, in the different regions. So what are your ideas of having those open back up? So having a PD breastfeeding coalition, upstate breastfeeding coalition. So a lot of times local, like Sarah was saying, you can get some things done locally versus us trying to do it statewide. And then those groups can actually come to the state coalition and bring some ideas back. So what do you think about that? Or have you heard anything? I mean, I know I ended up I live in the PD area, so I would attend the PD coalition, but it just it hasn't been going on for a couple of years, I think now. Anybody else want to speak to their region?
That's something. Who's laughing? Is that Rachel?
It's Rachel. Yeah. I don't know about, going as far, committing to trying to start a regional coalition or anything like that at this point. But I think maybe the first step would be even just trying to initiate that local connection. I tried to for this meeting. I tried to reach out I emailed everybody that I knew that was in my region to see if they wanted to kind of get together with me today to attend virtually, and I didn't hear back from anyone. So even if we could maybe at least in my region, and I'm in Rock Hill, to start just trying to connect locally with people that I know that are in this area and interested, and whether it be for to attend as a group to the virtual meeting or just to kind of try and connect even, I don't know, monthly on a conference call or in person for coffee.
That's right.
I mean, I'd really like to start connecting. Yeah, I'd love to start connecting with people in my region, because that also helps me know who to be referring my clients who give birth at my hospital to how to, I know some people, but I don't know everybody that I sent emails to. I can't say that I purposely met them. And so then I really don't know what kind of services I might be referring them to if I don't know what your services are, I can't refer them to you. And I just think it'd be nice if we could connect locally. So again, I'm in Rock Hill, so please, please connect with me. And my work email is rachel.miller@tenethealth.com. I'll put it in the chat.
Awesome. Thank you, Rachel.
Mm-hmm. So my dog's wagging her tail. I don't know why, but she liked what you said, Rachel. Slapping the papers on the floor. I don't know if y'all could hear it. Which I shouldn't have papers on my floor, but there you go. We do have, if you go to the website, we have that little interest group capability. Like we talked about this last year, but so far nobody's taken advantage of it. Just let me share our website for a second. And
Sarah, do we need to quit recording now?
Oh yeah, that's a good idea. Okay, thank you. That always takes me a second. Okay.